There was a cluster of pneumonia cases in the city of Wuhan in China during December 2019. A part of the early cases were recorded visiting or working at seafood animal life market at Wuhan, China. The disease was caused the newly discovered coronavirus and was subsequently named as COVID-19. COVID-19 was spread within China to the rest of the world. On 30 January 2020, WHO declared a public health emergency of international concern. In this video, I will share to you guys about COVID-19. Always keep in our mind that this is the new disease that rapidly spreading among the world. It also might change our future if we not take a serious attention on this disease. What is coronavirus? Coronavirus is a large group of viruses that consists of a core of genetic material surrounded by a lipid envelope with protein spikes. It gives the appearance of a crown, and crown in Latin called as corona, and that is how this virus got their name. There are different types of coronavirus that cause illness in animals and humans. In human, coronavirus can cause respiratory infection that ranging from common cold to the more severe disease. These include the severe acute respiratory syndrome coronavirus that first identified in China 2003 and Middle East respiratory syndrome coronavirus that first identified in Saudi Arabia at 2020 and SARS-CoV-2, the name of the virus that caused the COVID-19, and it is also first identified at China. So, where did this new virus come from? Coronavirus circulate in a range of animals, and sometimes this virus can jump from animals to human, and it is called as spillover. It also depends on the range of factors such as mutation of the virus and increased contact between animals and humans. For example, MERS-CoV is known transmitted from the camel, and SARS-CoV is known transmitted from the civet cat. So, how does this disease spread? This disease spread from person to person through droplets. Whenever an infected person releases those droplets close to another person, such as in coughing, talking, or sneezing. It also can spread when infected droplets laid on an object, and when the person touches them and then touches their eyes, nose, and also their mouth. So what are the symptoms? The incubation period, which is time taken from exposure to the virus, and development of the symptom is on average from 5 to 6 days. Also can range from 1 to 14 days. There can be range of symptoms from very mild to severe, and some people may not develop symptoms. Common symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. Some people reported loss of the taste or smell and develop in skin rash. In more severe cases, they could be pneumonia, organ failure, and sometimes death. 80% of cases recover from the disease without needing special treatment. But there are some people who are at risk of serious illness. They include older people or people with underlying medical problems such as a chronic respiratory disease, obesity, diabetes, high blood pressure, heart disease, or cancer. There are a number of effective ways to prevent the spread of the disease. These include covering our mouth and nose when coughing or sneezing with a flat elbow or tissue, and surrounding the tissue in a closed bin immediately after use. Wash hands regularly with soap and water or an alcohol-based hand rub. Maintaining at least 1 meter distance from people, and the appropriate use of masks and personal protective equipment, especially in health settings. It is important to stay home if you are feeling unwell and to call a hotline or a medical professional. But if you have fever, cough, difficulty, or breathing, seek medical care early and share your travel history or contact with someone unwell with your healthcare provider. That's all the quick look about COVID-19 with me, Narusami Saidi. Always remember that this is the new disease, so what we currently know might change. Always remember to stay safe and always follow physical and social distancing in order to prevent this disease from spread. Thank you for watching.